Thanks for coming on this fantastically sunny Cardiff morning. I had two versions of this prepared. One was this miserable Cardiff morning and the other was a sunny one, so I'm glad I can use the sunny one. I think of all the events that I get involved in over the year, this one tends to be one of the most tiring but also the most rewarding, because we all put a lot into it. People here, volunteers, the stall holders, the people who support it with funding, the people who come and attend. I think we all have a very tiring, exhausting day, but at the end of it we feel we've all learned a lot. I think the public who come get introduced to a wide range of health initiatives and services. The people who provide the stalls learn a lot about the people who come, the communities, and we also learn a lot about each other. It's surprising how many people find out organisations exist that we never knew about, and they start to make links themselves. So I think on every level, this is one of the most rewarding things that I tend to get involved in. A huge number of people get involved, and I'm not going to go through all of them because they all are listed on the programme and various other pieces of paper. But it's a great pleasure today to introduce Mark Drakeford, our Minister for Health and Social Services, who's going to say a few words to open the event.
Well, thank you very much indeed. Diolch yn fawr iawn I chi, pleser mawr I fi I fod yma. It's a great pleasure for me to be here today and to help in opening the 6th annual Minority Ethnic Community Health Fair, which is a fantastic achievement, I think, to have now become such an established part of the health landscape here in the city. And I'm particularly pleased to be here, not simply as the Health Minister, but my own constituency, the part of Wales that I represent at the National Assembly, is the Cardiff West constituency, and I live in the Riverside ward of Cardiff West, which, as many of you will know, is the most ethnically diverse ward of any part of Wales, with fantastic communities from Bangladesh, Pakistan, and from many other parts of the world. Before I became an Assembly member, I used to work some of the time at the university in Cardiff, and I took part in a very small research project in which we just counted the number of languages that were spoken every day on the playground of the school that my children happened to be attending at the time. And there were over 40 languages being used on the playground, absolutely routinely, by children who attended that school. And I think that is a most fantastic opportunity that children who went to that school had to hear from and learn about the worlds that other people inhabit. But we know for sure that people from minority ethnic communities are presented with a series of health challenges which mean that we need to provide services that are tailored to their circumstances. And the National Assembly has a proud record of this right from the very start. And I've been involved in the National Assembly in one way or another since the year 2000. And back then I was the health advisor to the Health Minister, Jane Hunt. And Jane and other people at the Assembly were very keen from those very early days to establish an eye care service that met the needs of people from minority communities, because we know that particular sorts of eye disease associated with diabetes and other conditions are particularly prevalent in some communities, and we have to do extra things to make sure that people in those communities get the services that are important to them. And that sense of being alert to the needs of diverse people living in Cardiff has been part of the Assembly's history throughout. So this last year, we have spent a great deal of time on the floor of the Assembly talking about organ donation, talking about the new regime of organ donation that we are introducing in Wales. And one of the key groups that we have had in mind during the whole of that process have been people from minority ethnic communities, because we know that a far higher proportion than the number of people in the general population from minority ethnic communities will need organ transplantation. 27% of people on our waiting list for organ donation come from black communities. And yet, people from black communities on the organ donor register very much underrepresent black communities here in Wales. So we've known from the very outset that there is a very particular job of work we have to do to reach out to people of Muslim heritage in particular, to explain to them the way in which the law is changing, to explain to them the particular needs that people in their community face and how they can help and how the new law in Wales will help that too. So amongst the many stalls and opportunities that there will be here today, there are a group of people from an organisation called Cognition, who are helping us to make sure that we get our messages out into those communities. And they've done a fantastic amount of work already, visiting mosques, talking to groups, eliciting the help of community leaders to help us get our message across. And they're here in the front here. I can see John and others, and they will be here to talk to people about the new law and the way in which the changing regime of organ donation in Wales will be of particular importance to people from our minority ethnic communities and part, therefore, of the work that you are doing today. So let me just end by thanking you all for the work that you will be doing during the day. It will be a long and intense day, I know. And we know that in the whole field of health, we have a job of work to do. Not simply to provide services that are important for people, but to make sure that people know that those services exist and that they feel confident that those are services that are properly accessible to them. We know that there are many different groups in our society who feel that taking that first step across the threshold of a service is the hardest step they make. They're fearful that they will not be welcome, they're fearful that they will not be understood, they're fearful that their particular needs will not be recognised by the service. And part of today is very much about breaking down those barriers of understanding, of allowing people to talk, allowing them to ask questions, allowing them to feel that when the need arises in their lives or in the lives of their family, that they will feel confident in making that contact that we know can make such a huge difference in their lives. That's the job of work that you will all be doing today. We're immensely grateful to all those organisations and all those individuals who downstairs will be offering health checks to people as the day goes on. It's an immensely important job of work that you are doing. It's a very important day in the calendar for the health service in Wales, and I thank you all, individually and organisationally, for the contribution that you will be making over the hours ahead. Diolch yn fawr iawn I chi gyd.
Thanks very much, Minister. It was an excellent opening speech, and it really just set the scene for the day. So, thank you very much. Go back to your stalls, crack on, and we'll throw the doors open. Thank you.